Do that yet, but I'm gonna go ahead and let you know. I'm gonna check her radial pulse to see what the amplitude is. Does it feel strong or weak? Because when I come back in, if I put too much pressure on her arm, that pulse might get weaker, and then I know that the restraint was on too tight. So I'm gonna feel the pulse. I'm gonna ask her to wiggle her fingers, and I'm gonna ask her to squeeze my fingers like this, no more than 2, so I can see how strong her fingers are. All right, and then at the same time, I'm feeling if her hand is warm or cold, and I'm seeing what color it is, if it's pink. And then there's another thing that we do called cap refill. It's capillary refill, and what we're doing is we're compressing all the blood out of the little capillaries, and it turns the skin or the nail bed white. And so then when we let off, we count to see how long it takes for those capillaries to refill. And it works. I forgot now already your name.
Laura.
Laura. I don't know. Sorry. Laura. Okay. So most people do it on the nail bed. That's kind of a tender spot. If you can do it on their skin, that works just as well. So I'm going to press real hard for just about 2 seconds. Then I let off. 1, 1,000, 2, 1,000, 3, 1,000. And see, she's already pinked back up by 3 seconds. The normal capillary refill is 3 seconds. If it takes longer than 3 seconds, then that's something I would report, okay? All right, so I've done this, and I've decided that it's safe. There's no bruises. There's no non-intact skin. There's not an IV catheter right there, which I wouldn't want to put it on. All right, so then I'm going to place it around her wrist. And this has a Velcro and then a little strap that clicks on, and then you snug it down. And then I want to make sure I can get 2 fingers under there easily. All right? And I even ask the patient, does that feel tight? They may say it does, but okay. Then I get ready to put it, tie it to the bed frame. And since the bed frame's so low, everybody, you're not going to tie it to a side rail, right?
No.
Okay. But I'm going to use the side rail. See y'all. Oh, wait a minute. Let me do this. I'm going to use the chair. Oh, goodness. Somebody needs wheels.
Me?
You need wheels on that thing, girl.
I'll go back.
That's your first body mechanics lesson. All right. So if you don't mind just kind of holding this for me. So now I've brought it over the side of the bed, down to the bed frame. And when I say bed frame, I mean the part that the mattress sits on. And I don't want to tie it at any of the joints where the mattress bends, okay? Because then it'll get trapped in there and you won't be able to get it loose. And if there's a fire, you won't be able to get the patient out of there real quick. So I bring it over to the side, and I go in from the back, bring it up, and I come around, make a loop, take my tie, grab another loop, and then I tighten it down like that. And now, that won't come loose. I'm trying really hard, and it's loose. If you ride horses, it's the same kind of knot. But I don't remember if I sent the videos out. Did I send y'all
Yes.
the videos?
Yes.
There's a really good video. She shows it. It's so easy to follow her. If you have trouble remembering, try that. Okay. Now, do you always have to use a wrist restraint like this?
No.
If all they're doing is just kind of reaching for stuff, you have an option. This is less restrictive. It's called a mitt restraint. You put it on the patient. Do your same neurovascular assessment before you put it on. Then it goes on, and it's just Velcro that does it. And now they can move their whole arm around, but they can't put their hand around something to pull it out. This is better. Just know that what's in your scenarios, that's not reality. We don't put wrist restraints on somebody to keep them from pulling their IV out. We try something else.
And there's other different types, like the bed alarm. There's the
Yes.
mobile sitter. It's like a big dome that sits in the patient's room. And when they start moving and trying to do stuff or pick at stuff or get out of bed, it'll say, Mr. So-and-so, get back in the bed, or don't pick at that. And they just look around to see where it's coming from. And sometimes they'll try to do stuff just to get that person talking. But it's called a mobile sitter, and it's a nurse sitting up in an office somewhere, and she has so many patients that she's just looking at everybody, and that helps, with people that are set a fall risk and may fall out of bed. But again, you have the bed alarm. When the bed alarm goes off, every nurse is to go to that area. St. David's is now instituted, and I don't know what Seton, they have yellow band, fall risk,
Yes.
yellow socks, fall risk. St. David's has a yellow light in front of every room. You go down the hall, everybody's light is lit up. They're a fall risk. Yellow is the key. Okay. Who works at Seton?
They put flags.
So they have flags. They used to have little
They have
little
lights.